Hi everyone, I'm David. Welcome to Asian Hospital and Healthcare Management. Here, we will discover the newest breakthroughs in hospital technologies, digital health, clinical excellence, and patient care innovation. Whether you're running a hospital, leading a care team, working with medical technology, or shaping healthcare strategy, you'll always find something that helps you stay ahead. Want more? Subscribe today at www.asianhm.com/subscribe and get the latest updates straight to you, anytime, anywhere.
Hello, I am Sarah, and today we're diving into the world of value-based care. Dr. Tamra Sunbull, MD, MBA, FIMS, CFIAMS, PMP, Group CIO at Fakey Care Group, tells us how value-based care is transforming healthcare, shifting the focus from volume to patient outcomes, and why it's key to driving better quality and efficiency. We'll explore the strategies healthcare organizations are using, unpack the challenges in aligning incentives, and look at how technology and data-driven insights are shaping the future of care.
Hi everyone, it's great to be here. I'm Dr. Tamra Sunbull, MD, MBA, FHIMSS, FIMS, PMP, Group CIO at Fakey Care Group. Today we'll be looking at value-based care, why it matters, how it helps improve patient outcomes and provider performance, and how it's reshaping the future of healthcare. Value-based care is transforming healthcare systems by shifting the focus from volume to outcomes. Grounded in proactive, data-driven, and patient-centric models, it aligns incentives across stakeholders, improves population health, enhances patient and provider experiences, and reduces cost inefficiencies, ushering in a smarter, more sustainable future for healthcare delivery. In an era where healthcare systems are increasingly under pressure from rising costs, aging populations, and an escalating burden of chronic disease, the global shift toward value-based care offers not just a corrective measure, but a revolutionary redesign. More than a reimbursement model, value-based care is a comprehensive strategy that aims to improve health outcomes by reimagining how care is delivered, measured, and rewarded. The new era of healthcare, from reactive and fragmented to proactive and integrated. Healthcare systems worldwide, many of which were designed in the post-World War II era, still operate as sick care systems that are reactive, fragmented, and dependent on episodic interventions. In such models, healthcare professionals rely on patients to present symptoms before acting. Patients are passive recipients of care, rather than active partners. Visits are symptom-focused, rarely addressing root causes. Continuity of care, prevention, and health promotion are not core tenets. This outdated approach is costly and often ineffective, especially given the growing global burden of chronic diseases. According to the World Health Organization, chronic illnesses now represent over 50% of the global disease burden. The opportunity: preventive health care. Preventive health care focuses on stopping illness before it starts by proactive care, identifying at-risk individuals early and intervening before symptoms develop. Predictive care, using data analytics and AI to forecast risk trajectories and plan interventions further upstream. This shift from reactive to proactive is foundational to the success of value-based care models. From volume to value. Traditionally, healthcare has operated under fee-for-service structures, incentivizing volume over impact. In this model, success is measured by the number of visits, procedures, and admissions, rather than patient well-being. While this approach drove infrastructure expansion and medical innovation, it also led to inefficiencies, redundant testing, and fragmented care. Studies have shown that up to 30% of healthcare spending is considered waste, with much of this due to unnecessary services and lack of coordination. This challenge is even more pressing in publicly funded healthcare systems, where cost efficiency is essential to long-term sustainability. As global health spending is expected to exceed $10 trillion by 2030, governments must increasingly prioritize models that reduce inefficiencies and improve outcomes. Value-based care becomes not only a better clinical model, but also a more fiscally responsible one. The urgency is further driven by the global rise in non-communicable diseases. According to the World Health Organization, NCDs account for 74% of all global deaths, with cardiovascular disease, cancer, chronic respiratory disease, and diabetes leading the list. This burden is accelerating due to aging populations, urbanization, and lifestyle-related risk factors. Managing these conditions more effectively requires a shift away from episodic interventions to proactive, coordinated, and holistic care models. Value-based care flips this paradigm. It rewards providers for achieving optimal patient outcomes, emphasizing prevention, care coordination, and long-term health improvement. The goal is to shift from reactive, episodic treatment to proactive, integrated management, especially for chronic conditions that account for a significant portion of global disease burden. The Quadruple Aim, a framework for transformation. At the heart of value-based care is the Institute of Medicine's Quadruple Aim, a strategic framework designed to guide healthcare systems toward better outcomes. Improving population health. Enhancing the patient experience. Improving clinician well-being. Reducing the cost of care. This sequence is intentional. Reducing the cost of care is not the starting point. It is the natural byproduct of achieving the first three aims. When systems focus on improving population outcomes, designing care around the patient, and ensuring the well-being of healthcare professionals, the financial efficiencies follow. This holistic view aligns all stakeholders toward shared value rather than isolated performance metrics. This framework is not theoretical. It is actionable. Countries and health systems around the world are beginning to operationalize it by investing in digital infrastructure, redefining workflows, and reshaping incentives. Digital health, the backbone of value-based models. Digital health technologies serve as the connective tissue that makes value-based care viable. Predictive analytics, remote patient monitoring, AI-powered risk stratification, and electronic health records enable care teams to make real-time, informed decisions. These tools bridge gaps across the continuum of care and empower both clinicians and patients. Digital platforms also play a critical role in preventive therapies, a cornerstone of value-based care. For example, population health analytics are used to identify individuals at risk for type 2 diabetes and engage them in lifestyle interventions or early pharmacological management. Vaccination programs for influenza, HPV, and COVID-19 have been significantly scaled through digital registries, reminder systems, and mobile outreach apps. Similarly, cancer screening programs such as digital mammography tracking, colorectal screening outreach, and AI-enabled risk stratification for cervical cancer help ensure timely detection and intervention. For example, the United Kingdom's National Health Service has piloted virtual wards and remote monitoring programs that enable patients with chronic conditions such as COPD or heart failure to be safely monitored at home. These digital initiatives leverage predictive analytics and wearable devices to reduce hospital admissions and improve self-management. In Singapore, the Ministry of Health's Healthier SG initiative uses digital health tools to build strong primary care networks with a focus on prevention and chronic disease management. Patients are enrolled with general practitioners and supported through mobile health apps, digital care plans, and AI-powered decision support systems. In Australia, the Sydney Local Health District's PaVirtual is an example of a fully integrated virtual hospital, which combines telehealth consultations, digital monitoring, and mobile care teams to manage patients across a range of conditions, from post-operative recovery to palliative care. These examples showcase how digital infrastructure, when strategically aligned with care models, can drive tangible improvements in outcomes, patient satisfaction, and resource efficiency. Personalization through population health management. One-size-fits-all care is no longer acceptable. To deliver meaningful value-based care, we must proactively reach out to individuals before they become patients, addressing care gaps early and guiding them toward healthier outcomes. Population health management lies at the core of this strategy by enabling segmentation and tailored interventions based on risk profiles. Individuals are not just seen as clinical cases, but as whole persons influenced by a constellation of factors. Crucially, many of the factors that influence health outcomes are non-clinical. These are known as social determinants of health, and include economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, social and community context. Failure to account for these can render even the most advanced clinical care plans ineffective. For example, asking a wheelchair-ridden individual to complete a daily step count fails to recognize their physical limitations. If we expect people to take action, interventions must be personalized, realistic, and empathetic to their lived realities. Moreover, even among individuals already living with chronic conditions, the aim is not only to manage the disease but also to prevent complications, such as preventing retinopathy or kidney failure and diabetes, or reducing the risk of heart attack and stroke in hypertensive patients. Personalized, targeted care pathways informed by data and social context are essential to making this possible. Health systems that embrace this model, such as the GCC's emerging digital-first approaches, can identify high-risk individuals early, intervene with precision, and track performance with transparency. This approach not only improves outcomes but also builds trust and accountability across communities. Interoperability and data democratization. To deliver coordinated care efficiently, data silos must be dismantled. Interoperability ensures that critical patient information flows securely and seamlessly between providers. Democratization of data via self-service analytics, patient portals, and national health exchanges empowers both clinicians and individuals. AI further enhances this by enabling real-time insights, identifying care gaps, and even predicting decompensation before symptoms appear. These advancements support clinicians in practicing at the top of their license while helping patients take control of their health. Public-private partnerships, a catalyst for value. Achieving value-based care at scale requires systemic change. Public-private partnerships can play a vital role in this transformation. In regions like the Gulf, PPPs are evolving beyond infrastructure projects toward investments in digital primary care, chronic disease management, and workforce training. The key is finding the triple win, where governments, businesses, and citizens all benefit. This requires co-investment in health system capabilities, regulatory alignment, and shared accountability for outcomes. Real-world technology use cases. A range of innovations is accelerating the shift towards safer, smarter, and more connected care. Technologies powering value-based care delivery revolve around the following themes. Patient as partners in care includes patient bedside portals, symptom checkers, questionnaires, wearables, and remote monitoring. Care is done with patients, not to them. Recognizing that most care happens outside hospitals, this theme supports connected care environments. Prevention before intervention, actionable care scoring, risk stratification, and alerts for care gaps and best practice advisories help intervene earlier and more effectively. Clinical decision support involves pathways, evidence-based order sets, and AI models. Reducing clinical variation and standardizing care, utilizing clinician and patient care pathways and outcome tracking to reduce unwarranted variation. Democratization of data via health information exchanges, clinical documentation improvement, actionable data at point of care, open notes, and command centers. Dashboards for utilization optimization, used in demand management, care gap closure, and pay for performance. Registry measurement and benchmarking collects data for safety, quality, risk, and efficiency evaluation across populations. Improving access through telehealth and remote monitoring, virtual visits and remote monitoring. Automation for staff augmentation, chatbots, NLP, and pharmacy robotics allow caregivers to focus on top-of-license work. Virtual and mixed reality, for use in training, mental health, and remote rehabilitation. Predicted biomarkers for intervention, AI-supported screening for diabetic retinopathy, peripheral vascular disease, and wearable sensors predicting decompensation. Precision medicine and gene editing, genomics, digital twins, and personalized therapeutics reflect the next frontier of high-impact, data-driven care. These tools are not futuristic. They are operational today across many regions and enable systems to go beyond incremental improvement and achieve measurable progress in safety, quality, and equity of care. Challenges: aligning incentives and infrastructure. Despite its promise, value-based care faces hurdles. Misaligned reimbursement models still favor volume over value. Cultural resistance among providers unaccustomed to new workflows, data integration and governance issues, limited infrastructure in underserved regions. To overcome these, we must rethink how care is paid for, how performance is measured, and how success is shared. Countries must develop robust regulatory frameworks that support innovation while protecting equity. A case for collaborative action. Value-based care cannot be implemented in silos. Collaboration is the foundation for success. Whether through data sharing, co-design pathways, or ecosystem-wide partnerships, stakeholders must align around common goals. Within the Kingdom of Saudi Arabia, national transformation efforts have embraced co-creation among patients, providers, and policymakers to drive health improvements. The national model of care connects 6 systems of care: keep well, planned care, chronic care, urgent care, safe birth, and last phase, with 6 layers of service: activated people, healthy communities, virtual care, primary care, general hospital care, and specialist hospital care, all focusing on the physical, mental, and social well-being of individuals. The road ahead. The future of healthcare will be proactive, personalized, and participatory. Value-based care is not just a reform, it is a reinvention. To succeed, we must embed digital tools within clinical workflows, restructure payment models around outcomes, foster continuous learning and upskilling, build trust through transparency and community engagement. In doing so, we can shift healthcare from a system that reacts to illness to one that fosters lifelong wellness. Value-based care is not just beyond the bottom line, it's the foundation for a better healthcare future.
Thank you, Dr. Tamra Sunbull, for sharing your insights on the future of value-based care. Your perspective on how this model enhances patient outcomes, improves provider performance, and drives efficiency is truly valuable. We appreciate you highlighting how, despite the challenges, value-based care is transforming healthcare delivery and shaping a smarter, more sustainable system. More great conversations and expert perspectives are on the way. Stay tuned, and until next time, take care, everyone!